First, thank Dr. Askew, who is here, our Deputy Chief Administrative Officer for Health and Human Services, and to thank him for his tireless efforts. I'd like to also thank Olo Alekemi, who is our Chief Operating Officer at the Health Department, who is also, as you heard here, to provide answers. And also would like to thank Dr. Carter, thank the entire Health Department for the amazing work that they continue to do every day. Today, I would like to provide you with an update on our COVID-19 numbers. In addition, I'd like to provide a brief update on our vaccination efforts and provide details on the relaunch of our emergency rental assistance program. Since last March, we are now at about a year mark of this pandemic. 73,702 Prince Georgians have confirmed cases of COVID-19. We've had 7,477 of our residents who have been hospitalized, and 1,305 of our members, community members, have passed away. The toll of this illness is an understatement to say that it has been a trying year for us. This has been a very, very difficult year, and the toll has been quite high. And we are continuing to do all that we can to reduce the impact of this pandemic on our community. We continue to pray for each and every family who has been impacted in some way by this pandemic. This has really impacted every corner of our community. And again, I'd like to also thank Prince Georgians who have been absolutely amazing during this pandemic. Thank you for your sacrifices. Thank you for all that you have done to help us make it through. Despite the terrible loss that we have all experienced this past year, today we believe that we have good reason to be optimistic about the future. I am happy to report that our COVID-19 infection rate has declined, meaning that we are seeing fewer new COVID-19 cases and an overall decrease in cases. In addition, our 7-day average positivity rate as of February 27th is 4.4%. This is down from 7% just a month ago. This is really, really fantastic news for us. Our Deputy Chief Administrative Officer for Health and Human Services, Dr. Askew, in a moment will provide a in-depth update on our current COVID-19 numbers. However, I want to stress that as we saw over the holidays, our progress can quickly reverse and cases can rise again. And so I ask all of you, in spite of the success that we're seeing and going in the right direction, to please continue to be vigilant. We need each of you to continue, please, to wear your mask, to social distance, to wash your hands, to do all of the things that we have instructed over this last year to keep all of us safe. To help keep our county going, we're also just asking you to continue to work together as a community so that we keep our friends and our family members. So let's keep each other accountable and do all we can to continue to contain this virus in our community. While we're pleased with the progress that Prince Georgians have made in reducing the transmission of COVID-19, ultimately we know that the vaccine will help us end this pandemic for good. And so we are doing everything that we can to ensure that vaccinations proceed smoothly and working to correct any issues that arise during this unprecedented effort. As I've said before, right now, vaccine supply is the biggest limiting factor in being able to quickly vaccinate Prince Georgians. And let me repeat that because it bears repeating. The biggest obstacle that we have right now as a county is our limited supply. And that is what is standing between us being able to quickly vaccinate Prince Georgians. As you may already be aware, during the week of February 15th, the vaccine supply chain was disrupted nationwide, and this was due to the winter weather. We had to cancel appointments due to the weather on Friday, February 18th, and as a result of the delay in our first dose shipment that we were promised, we also had to cancel first dose appointments from Friday, February 19th through Monday, February 22nd. We did have enough supply of second doses on hand to continue administering second doses without interruption. Individuals who had appointments canceled during those several days due to the weather should have already received their rescheduled appointments by our health department at this point. The inclement weather and the lack of first doses, in spite of all of that, we were still able to administer almost 6,600 vaccines to residents. That was one of the highest weekly totals by our health department, and it would have been our highest total at that point in time if it had not been for the inclement weather. Although the weather challenges were unfortunately out of our control, I'm happy to report that on Monday, February 22nd, we received 8,400 first doses of vaccine from the state of Maryland for the week, and that number included the doses missed from the inclement weather and our allocation from last week. Those 8,400 doses were out of the door and administered by Monday of this week, so within a week, we were able to get those doses into the arms of Prince Georgians. We did provide 1,750 doses of this supply to Luminous and MedStar Southern Maryland to help vaccinate county residents as well. And so we've been working very closely with our partners, and Dr. Askew again will speak to that in just a moment. Last week, we also set a record of weekly vaccines administered by our health department, nearly 8,000 in total. This week, we have received 4,800 first doses from the state so far, as well as 1,400 doses of the new Johnson & Johnson vaccine. We expect that we will utilize all of these doses by this Monday. So again, within a week or less than a week of receiving them, we have administered all of the vaccine that has been allocated to our county. Also, this week we are averaging 1,800 doses a day through our health department. And even though supply is still a limiting factor, we have already administered nearly 7,500 vaccinations so far this week and are on track to set another record weekly total of vaccines administered. Our vaccination administration efforts also include mobile vaccination units because we recognize that there are many in our community who cannot make it to our facilities. And so this has allowed us to fully utilize all of our assets. The 3 mobile units can administer about 150 vaccines per day. And last week we visited the Cameron Grove Senior Facility, United Methodist Church in Hyattsville, and also worked with Casa de Maryland. We were able to vaccinate 478 pre-registered seniors in 3 days. This week, we returned to Cameron Grove Senior Facility to vaccinate additional seniors who were pre-registered, and we also visited a domestic violence shelter. So far, we have already vaccinated 282 residents this week through our mobile units, and today and tomorrow, Friday, we're going to be sending those units out again, and they will be vaccinating homebound seniors across the county, meaning those who are not mobile, who are not able to come out of their homes. And so we're actually going into the homes and vaccinating our homebound seniors across the county as well. We will continue to utilize these mobile units to vaccinate homebound individuals, and we are partnering with community organizations and our faith-based community to ensure that vaccines are being distributed in an equitable manner to those who need it most. And so we're going to be working with the faith community. Look out for us for pop-up clinics that we're going to be hosting around the county, including at our churches and in other locations. We'll be letting you know where they are. We're also going to temporarily close our sports and learning vaccination clinic, and this is really important to get this information out, and we'll continue talking about it from March 13th through March 28th, and it will reopen on March 29th. We're closing it due to scheduled maintenance work that needed to be done at that facility. This is out of our control, and we're not scheduling appointments at that site due to this closure. Now, to make sure that we don't lose vaccination capacity, not to worry, we're going to continue those vaccinations. For our health department, we are opening 2 new sites that will administer the vaccines that would have been administered at the Sports and Learning Center. We'll have a soft launch of a vaccine clinic at the Kentland Community Center on March 8th, and then the soft launch of a clinic at Cedar Heights Community Center on March 15th. And so those 2 sites will be up and going when the Sports and Learning Center becomes unavailable to us. We'll continue vaccinating through those 2 sites, and we hope to also be able to continue operating these new sites even once the Sports and Learning Center reopens for vaccinations. With all of our current vaccination sites and our mobile units, Our county health department at this moment has the capacity to administer 2,000 doses per day, and we're working to increase our capacity even further. So we're expecting that our capacity will continue to grow. Again, this week we only received 6,200 total doses for new appointments. Again, this week, what the county government has available to us is 6,200 vaccines that we have received from the state. And now I've heard from many of you, fairly enough, who have been saying, where in the world are the vaccines? That's been the ongoing question. Where in the world are our vaccines? And we've been open and transparent with everyone from the very start of this rollout about where we were. When we had difficulties, we said so. And we have worked constantly to address those issues. And I am so happy to report to you that we have addressed the issues that I explained to you and have overcome those issues. Right now, the truth of the matter is this, and I don't know how else to say it. We cannot administer vaccines that we don't have. That's the chief issue. I can't say it any more plainly than that. The county now has the capacity to administer these vaccines. We're doing so now at a pace that we're very comfortable with. We're getting everything out the door that has been given to us, but we cannot administer a vaccine that we don't have. And so we are quickly utilizing the new first doses that we received. We have the capacity to administer additional doses when we are provided those doses by the state. And that doesn't even include, by the way, all of our healthcare partners who are helping us to administer vaccines. Again, Dr. Askew has done an amazing job of working every day. He's working the phones, and all of us have been working daily to establish relationships with partners who can help us to administer the vaccines as we receive, because we are expecting that the supply will continue to increase, and we wanted to be prepared. Dr. Askew will talk about those partnerships in a moment, but I can tell you that our vaccination partners are requesting additional vaccines from us because they're in the same position where we are. That they are not able to utilize their full capacity to vaccinate Prince Georgians due to the lack of vaccines. We know that the new Johnson & Johnson vaccine is now available. We know that we have 3 vaccines all total that are approved and available to us, and based on announcements from the Biden administration, we know that supply will increase in the coming weeks. And what I can tell you is that we are prepared to quickly handle and administer additional supply of vaccines when they are provided to us. And we have also, and I'm going to talk more about the numbers, but let me tell you about our appointment system. We have spoken a lot about our appointment system, and it's been no secret that this appointment system has been a source of frustration for all of you, and it has been a source of frustration for us. For many, as we initially relied on the state's scheduling system called PrepMod. We found that the state registration site created several issues, not just in Prince George's County, but honestly in jurisdictions across the state. This system has really been a challenge for all of us. It sends unsecured links, which allows them to be shared and allows people who are ineligible to schedule appointments. And this has created for us longer lines at our clinics since we have had to turn away individuals who are not eligible. This has created for us a situation that has been frustrating and disappointing to so many because when someone shares a link and we have hundreds of people who show up who are not eligible to have that appointment, it causes many of our seniors to have had to stand in line. These are unanticipated people we have not expected to show up at our sites. It's also caused us to have to turn away people. And so we know that this has caused some frustration, but we wanted to tell you how this happened. I know just yesterday, for example, I was talking with the team in the morning, and they said, oh my goodness, we have already on our books 2,000 people to come to the Sports and Learning Center. I just explained to you, we can't accommodate 2,000 people at the Sports and Learning Center, but those appointments, again, made through the state site, we have no control over that. And it's because people are sharing the link with friends, family members, colleagues, and those people go on and make the appointments, and we have to turn away people at that site. As I mentioned at the recent telephone town hall, we plan to swiftly move away from PrepMod and to use our health department's electronics record system to issue appointments. And that is an ongoing process. As I explained to you, we have undertaken that process. So we're in the process now of working with that system. But what I can tell you is that we already have tens of thousands of appointments through this new system that we have set up in phases 1A and 1B, which we are still prioritizing at this time. I want to remind you again that under the new system, the new scheduling system that we are using, we are sending you appointment dates, times, and locations directly. And we're doing this rather than sending you a link to have you schedule the appointment, for the reason that I explained a moment ago, is because when we send the link out, people share it. And then we have, hundreds of people, if not thousands, who show up. And so we're asking everyone, please be flexible with your appointments, because we are just now sending you directly appointments, dates, and times that we thought would be more convenient, most especially for our seniors, to have the certainty of an appointment. However, as we work to transition fully from the state system, something we've noticed, unfortunately, again, is the link sharing. And because we already had appointments scheduled for people in PrepMod, the state site, through March, those links are still being shared widely and utilized to schedule unauthorized appointments. And so I'm just asking everyone that if you received a shared appointment link from a family member or a friend, please do not utilize the link to schedule an appointment. If you are not eligible to receive the vaccine, we're turning people away for the reasons that I mentioned, because it has really caused long lines. We don't want our seniors standing in these lines, and we want to make sure that this process is as efficient as possible. And because we have a limited supply of vaccines, and we schedule our appointments based on that number, we may have to turn away people also who are eligible to ensure we have enough vaccine to administer to those who have authorized appointments. And so, in other words, people who don't have appointments but still may be eligible, if they're showing up with the link, those people we may have to turn away as well. So I know that this is frustrating to all. However, the issues with the state PrepMod site are out of our control, and we have had little ability to fix them. So if you didn't receive a link directly from the health department, we ask you please not to use those shared links to schedule appointments, because it is very likely that you may be turned away at the door and creates longer lines and delays. I want to briefly touch on the new Johnson & Johnson vaccine that has recently received emergency use authorization from the Food and Drug Administration. We have a pediatrician in the House, so I'm going to let him mostly talk to you about Johnson & Johnson. I know he will do so in a moment. But what I can tell you is that the doctors have assured us that this new vaccine is both safe and effective. This vaccine is only a single dose, and so this means that it is in some cases much more convenient and efficient for those who may have difficulty returning to our sites for a second dose. We've heard concerns from many. There is a lot of concern that the vaccine is not as good as the others because it is less effective. But I am told by the doctors that the Johnson & Johnson vaccine passed clinical trials with tens of thousands of people and was shown to be nearly 100% effective at preventing hospitalization, which has been a huge issue for us. And I'm also told that it also is very effective at preventing deaths from COVID-19. Moreover, it's been shown to maintain effectiveness against the variants that we have seen emerging. So we will have a number. We have all three vaccines here, and I'm told that all will provide the protection you need against COVID-19. And we don't control the supply of vaccines that we're provided. I need to level with you about that as well, is that we don't control which kind of vaccine we get from day to day. So on any given day at our clinics, we may only have one brand available. And I want to be clear that the scientists and the doctors have told us that they are all safe and effective and will help save our lives. And so we're going to administer those vaccines. Finally, I want to address one other issue related to vaccines, and that is vaccine hesitancy. This phrase has been used a lot lately, and I've heard many concerns from our residents. That's because, unfortunately, the narrative has become that Black and brown people are being vaccinated at lower rates because they don't want the vaccine. The truth of the matter is, while there are some in our community who have this concern, and I've talked about it before, I've heard from those individuals as well, in the community. Some have even been in my family who have expressed concerns about it. The main issue right now, however, is actually lack of access to vaccinations. It is not the hesitancy. Despite the fact that we have sent out tens of thousands of appointments, we still have nearly 118,000 people on our pre-registration list. These people who have signed up, because these are people who want the vaccine. We had over 150,000, and we are now down to, we have 118,000 people who are now waiting patiently because they want the vaccine and they're waiting their turn. And with only a few thousand doses a week coming to our health department, demand is far outpacing supply at this time. And again, let me just repeat those numbers again, because I think they bear repeating. What you have heard about Black and brown people not wanting the vaccine, well, we have nearly 120,000 people who are on a wait list in Prince George's County. And I just told you, our guaranteed amount that we get now each week from the state is 4,400 doses that we are guaranteed to receive each week from our health department. And so that gives you some sense about the difficulty of getting people vaccinated and the time that it takes to get all of those folks vaccinated. Again, we're hoping that our supply will increase very soon, and we can get through that number. It is absolutely our mission, and I can tell you this, this is what we do every day to ensure every resident of Prince George's County has the opportunity to receive this vaccine, and we will not rest until this is so. That every person who wants the vaccine in Prince George's County has the opportunity to receive it. That means we'll continue to advocate that we receive additional vaccines so that we can increase our numbers and meet the current large demand in our community. We are working along with our state delegates. We have worked with the county council. We have worked with others to advocate to make sure that Prince George's County is receiving the supply of vaccine that we need here to care for and vaccinate our residents. And this also means that we'll continue to conduct outreach to those who are hesitant because we can't afford to leave anybody behind with these life-saving vaccines. These vaccines not only protect us, but we take them because they protect our families, they protect our friends, they protect our neighbors, our church members, they protect the people that we love. And so each Prince Georgian that gets vaccinated puts us one step closer to being able to return to some sense of normalcy in the future. And we are, again, going to continue to work with our partners. We are urging every day that we receive an additional share of vaccine from the state. We have received some good news. I was able to talk yesterday with executive leadership from hospital system, and we are really pleased to hear that they have managed to make an arrangement. We worked together that they're going to have it at First Baptist Church of Glenarden, our very own First Baptist Church of Glenarden, which is the largest church in Maryland, which will soon serve in the next couple of weeks. We expect that they will open their doors and have the ability very quickly to be able to vaccinate up to 1,000 people per day at the First Baptist Church of Glenarden site. We've been working to get the supply of vaccine from the state to staff up that site. And we are going to continue to look for other opportunities. The University of Maryland College Park, we've got to get the University of Maryland College Park up and running so that we can vaccinate some of the zip codes in our county where we are hardest hit, where we have the greatest number of infections. We want to be able to reach people who are in some of those zip codes as well. So we're working to make sure we get, and not only that site, but again, throughout the county, we'll continue as the supply becomes available to work to open those sites. As we move ahead with our vaccination efforts, I know that thousands of Prince Georgians are still experiencing the economic impacts also of the pandemic. And today we are relaunching our emergency rental assistance program to help protect residents from eviction and to provide stability. So landlords who hold a valid county rental license who have occupied units may apply to this program. Emergency rental assistance covers rental payments that tenants have missed beginning April 1st of 2020. So going back to last year, April 1st, 2020, the ERAP can cover up to 12 months of back rent for each tenant. The monthly amount of assistance available is based on the actual rent and does not include late fees, interest, and other costs associated with tenant default. The rental assistance will be paid directly to the landlord on behalf of the tenant. Now, for a tenant to be eligible, they must have a valid lease in their name, and tenants must also meet the income eligibility requirements. Their annual income cannot exceed 80% of the area median income as determined by the Federal Department of Housing and Urban Development. So there are some rules that we have to comply with. Tenants do not need to provide a social security number or birth certificate to qualify for this program, and that's very important to note. While we're primarily encouraging landlords to apply for this program, if your landlord does not apply, we can also accept applications directly from tenants. However, tenants who directly apply are only eligible for up to 6 months of back rent and utility assistance. So if you need this assistance, we encourage you to please reach out directly to your landlord and ask them to apply on your behalf. Our Department of Housing and Community Development's website has a full list of requirements and information needed to apply, a list of organizations who can assist tenants and landlords with completing applications, and the application portal. You can access this website at hcd.mypgc.us. Again, hcd.mypgc.us. This program is funded by allocations from the federal government, and that's why we also, with respect to all of the guidelines about who is eligible and how we can give out those funds, we have to be very careful to make sure we are following all the guidelines, as well as the state as a part of the federal COVID-19 relief package, which became law this past December. And I want to thank our federal delegation for supporting this package and for the tremendous work they do to advocate for us, which included rental assistance funds. And I'm pleased that we now have yet another opportunity to support Prince Georgians and to provide critical assistance to our residents. So again, I want to thank you for joining us this morning for these important updates. And I know that we will continue to work together as a community. I want to thank you. Even as we round out now and we're close to a year, I can't tell you just how grateful I am to lead in a community like this one. I thank each of you for your sacrifices. I thank you also for how you've cared for each other. I thank you also for staying in tune with us, communicating with us, letting us know what your concerns and needs were, holding us accountable, working together. So I just appreciate so much every Prince Georgian. And as I have said from the very beginning to now, I assure you that the coronavirus will not have the final say, that we will make it through this period. We are seeing some light at the end of the tunnel. We're going to get these vaccinations to our residents. And as the supply increases, we're going to be pumping out that vaccination and getting it into the arms of Prince Georgians so that we can come back together as a community and as a Prince George's County family. So thank you all so much. And I'd like to welcome Dr. Askew at this point for his update.
Thank you, Madam County Executive, and good morning to all of you watching today. I would like to thank Prince Georgians for sticking together during this very tough time in our lives. And thank you for staying engaged and informed during this historic moment. I'll begin with the COVID-19 case data update, and then I will discuss the new vaccine coming our way, as well as our progress in protecting Prince Georgians with these safe and effective vaccines. COVID-19 is still spreading in Prince George's County and making a lot of people very sick, very sick. However, since the post-holiday surge, we have seen encouraging reductions in key data points. Our cases have trended down. Last week continued the trend with just over 1,000 new cases. We haven't been below 1,000 new cases per week since October of last year. So we are close, but we are not quite there yet. Our average daily case rate is coming down as well. It is now at an average of about 17 cases per 100,000 per day. That is finally below the critical level of community spread, but it's still a bit higher than we would like, certainly. The positivity rate in the county has gone down. As the county executive said at the end of last week, the percentage of positive tests had dropped to 4.4%. It's below 5% for the first time, again, since the end of October. Another data point we examine carefully watch is our infection rate. That measures how many other people, on average, are infected by a person who has COVID-19. The infection rate has been on the decline since early January, but has started to creep back up just a little bit. We are now at 0.91 infection rate, which means an infected person is infecting fewer than one other person's that they come into contact with. We certainly want to keep it below 1. The further below 0.9 that we get, the better. For perspective, our lowest infection rate of the pandemic was 0.74, and that was back in June. So as you can see, we still have some work to do, although we're making some significant improvements. The number of people who have become sick, so sick with COVID that they had to be hospitalized, is on the decline. Our COVID hospitalizations, as of Tuesday, there were 120 people in county hospital beds who had COVID. Our COVID hospitalizations have gone down by nearly 100 in just the past 30 days. Again, very good sign. The hospitals in the county have done an amazing job. They have built up their temporary bed space to historic levels, and they have helped the county's healthcare capacity stay strong throughout the pandemic. We cannot thank our hospital partners enough for taking care of our residents when they needed them the most. While we're seeing declines in our numbers, we are still in a tough battle, a very tough battle. Variants of COVID are present in Maryland. Data show that the variants can spread more easily from person to person than the original version of the virus. And as always, we are monitoring the data consistently and constantly to keep everyone safe and healthy. At the same time, we all have to keep practicing safety measures that we all know work, and we have to get vaccinated when it's our turn. Each week, the county makes progress in vaccinating as many people as we can, safely and through a lens of achieving equity. So far, over 78,000 Prince Georgians have received at least one vaccine dose. Over 78,000 Prince Georgians have received at least one vaccine dose. There is a growing list of public and private vaccination clinics open in the county and statewide. The more sites open, the more opportunity to get shots into Prince George's residents. The county health department has rapidly built up its vaccination capacity each week, as you heard from the county executive. We now operate 4 vaccination sites across the country, with more on the way. We have 3 mobile units to serve our senior citizens and other populations who need us to bring vaccine to them, and we are so happy to do so. We think that that is an important commitment to make, to take the vaccine to the people who can't come to the vaccine. It is so inspiring, especially to see our seniors lined up with such enthusiasm to get vaccinated and show the world just how important this is. Our mobile units are vaccinating hundreds of senior citizens each week. The partnerships we have formed and built upon are getting more robust by the week. We're tag teaming this massive effort by sharing doses with hospital systems, grocery store pharmacies, and other healthcare providers. We're sending names from our pre-registration list to the state and those partners. Right now, the health department alone, as the county executive mentioned earlier, is able to vaccinate more than 2,000 people a day. So you can do the numbers in your head. 2,000 a day, 7 days a week, 14,000 vaccinations possible, should we be able to receive that amount. We are hopeful that the vaccine supply will continue to keep up so we can keep expanding capacity and partnerships. Partnerships like we have with Luminous Health Doctors Community Hospital, which is helping us vaccinate our dialysis center staff and senior residents, and also partnering with us at Prince George's Community College to open up vaccination sites and vaccinate Prince Georgians. Kaiser Permanente, which continues to also vaccinate our teachers and school staff. We're sharing doses and waiting list names with MedStar Southern Regional Medical Center, who are also vaccinating Prince Georgians. And the University of Maryland Capital Region Health continues to vaccinate frontline health providers and seeking to expand their opportunities their opportunities and their efforts. We're also working with Walmart, who is vaccinating residents from our pre-registration list, as well as Giant, which is vaccinating some of our senior citizens. The ARC of Prince George's County is opening a clinic for residents 65 years and older. And finally, the state of Maryland, via our collaboration with its Equity Task Force, led by Brigadier General Burkhead, who's been a tremendous partner, has been reaching out to people on our waiting list to get them appointments at the state's mass vaccination site at Six Flags. We're excited about the Johnson & Johnson vaccine arriving in the county, which gives additional hope for a more plentiful vaccine supply and expansion of our efforts. The fact that it only takes one dose to protect you will speed up our journey out of this pandemic. The rigorous clinical trials showed that Johnson & Johnson vaccine is safe and very effective in protecting against COVID-19 illness, hospitalization, and most importantly, death. Again, most importantly, death. That's where the Johnson & Johnson vaccine is absolutely as effective as Moderna and Pfizer. I have received the Moderna vaccine, but I would also absolutely take the Johnson & Johnson vaccine if that's what had been offered to me first. And I would absolutely take the Pfizer vaccine as well. Ultimately, the best vaccine will be the one that is available to you first. The Prince George's County Health Department does not recommend one vaccine brand over another. The FDA has determined all three of these vaccines are safe and will protect you from COVID-19. And just like Pfizer and Moderna, the Johnson & Johnson vaccine will not give you COVID-19. But also, like Pfizer and Moderna, Johnson & Johnson may give you some side effects like some pain, redness, swelling in your upper arm from the injection site. Some of you may experience headache, fatigue, muscle aches, maybe a little nausea, maybe a little fever, all very short-lived. And for those of us who did experience some of those symptoms, they go away quite quickly. Even after you get vaccinated, you can still carry the virus and spread it to others who may not be vaccinated yet. This is an important point. Even after being vaccinated, while you won't get sick or you won't get serious illness, you may still be able to harbor the virus and pass it on to others. So it doesn't mean you can stop using the safety and protective measures that we've recommended all along. You must continue to wear your mask over your face, over your nose and mouth in public. Avoid gatherings, avoid travel if you possibly can, and stay at least 6 feet away from people who you do not live with. We also encourage everyone to get tested regularly, especially if you feel symptoms or if you are exposed to a person with COVID-19. I know the COVID exhaustion is setting in and has set in for many of you. It has brought so much disruption to all of our lives. We want this to end just as much as you do. Those of us in government, those of us in public health, we're tired too. But I am so proud of how far we have all come and the history that we will make soon. Stay strong and safe and get vaccinated. When your time comes, step up and become proud to be protected. Thank you.
Okay, so with that, we will open it up to any questions that you all may have.
What would you like to see the governor do for the state that has not been offered yet? That goes into the discussion from yesterday. Baltimore City. Dr. asked you if you could talk a little bit about the efficacy with Johnson & Johnson versus Moderna. That some the serious few residents who look at it and see Moderna and Pfizer have higher efficacy. Just explain that.
Okay, so your question is, what would I like to see the governor do?
The governor or the state.
Or the state, yeah, what like the state do? Well, we want to have our supply increased. We now have the capacity and the infrastructure in place to administer the vaccine, and we need to see the supply increase specifically, and I've made these requests known, Six Flags. The Six Flags site is one of the places that we would love to see the supply increase. So, for example, the numbers were released, and they showed us that Prince Georgians, unfortunately, only received about 11% of the vaccine that has been administered at Six Flags. So my request has been, I'd like to see 50% of the vaccine that is administered at a site in our county go to Prince George's County residents, or in the alternative, I believe that setting aside days for Prince George's County residents to go there, just set aside a day or days where we can administer vaccine exclusively to Prince Georgians. This would help us tremendously to be able to increase numbers by being able to utilize that site. I'd like to also see the site at the University of Maryland College Park would really assist us, because we have zip codes that are in really dire need of us getting in there and getting the vaccine. Many of our Latino community residents are in those zip codes, and those are some of the hardest hit areas where we saw the greatest infection rates. Were in some of those zip codes. And we are also looking forward to receiving additional supply to our health department so that we can really staff up some of these sites that we have with vaccine, and including the First Baptist Church of Glenarden. And again, I was able to have a conversation yesterday where I learned that is now going to be able to, in 2 weeks from this time, I'm told that about March 15th, that they are going to be rip-roaring ready to go, and they will open that site at the First Baptist Church of Glenarden, and by the end of the month, I'm told they're going to have the ability to give at least 1,000 shots per day at that site. And so we would like to have not only additional vaccine, but we need staff to help us at these sites, personnel, resources. So that's what we'd like is we just need the supply to increase, and we can get Prince Georgians vaccinated.
Why do you suppose that that number is what it is? I'm sorry, Will, Doctor, there's a subject still on the floor. Yeah. Will had a question that was. Oh, I'm sorry.
Oh, I'm sorry, yes.
Thanks. That's a terrific question and an important question. I'm probably going to make this answer longer than you want it. In any given year, with the flu vaccine, for instance, if we got an effective rate in the 60s, in the 60%, we would be thrilled. Tremendous vaccine, wonderful job. We're really excited. Moderna and Pfizer came out, released first with efficacies in the mid-90s, 94 and 95% for preventing COVID infection. So that's really terrific. Next, we have now Johnson & Johnson being released with an efficacy for preventing infection of about in the low 70%, low 70s in terms of percent effectiveness at preventing infection. Any other time, any other year, if those two hadn't been released, we would be jumping up and down and dancing and excited about how great this vaccine was. What we also know about Johnson & Johnson, while it's 70%, a little bit north of 70% effective at preventing infection, I believe it's in the mid-80s in terms of preventing serious illness and hospitalizations. That's also important. But the most important thing, and if you leave with nothing else, it is believed to be 100% effective at preventing death, just like Moderna, just like Pfizer. It's a life-saving vaccine. If that vaccine becomes available to you, please do take it. It is a lifesaver. Does that help? Okay.
Back to the Six Flags thing. I was going to basically ask you a question, but we know what the numbers are now, and why has it gone like that? Why are people from Montgomery, Howard, Anne Arundel able to dominate? What needs to change? We're all going to the press conference with the governor and the general.
Okay. Yeah, I mean, the numbers, the interesting thing about the numbers is there's really no commentary that's needed. The numbers speak for themselves. If you're in a jurisdiction, only 11% of the people there have been able to enjoy that life-saving resource. I think it says a lot. But why? I think that the unfortunate truth is that people have been made to compete for appointments. And the challenge is the people who are competing for these appointments are mostly seniors. These are people who are not necessarily tech savvy. We challenge them to, if your fingers are fast enough, you can get online and try to quickly, or if you have grandchildren who can assist you. So there's a whole equity issue that has been created, and maybe just not anticipated. The inequity that would have been set up may not have been anticipated, but the results, I think, speak for themselves. And so calling into homes, we've heard that, part of the strategy was to call into homes and to have, most of us know that, I'm going to be honest, I don't answer numbers I don't recognize. So you start calling into people's homes and with a number that people don't recognize. Some of these things didn't work necessarily for our seniors. So General Burkhead has done an amazing job. She and Dr. Askew have been on the phone multiple times a day, trying to work through this, and came up with the idea that General Burkhead began to text message many of our residents and found that this was much more effective in terms of actually being able to reach our residents who responded right away, and they got a much better result. And so it really is just a changing the approach to it. And that's why the suggestion has been made that why make people compete? And let me just also say this. Everyone wants this life-saving resource. We understand it. We do. Everyone wants the same thing for their families. We get that. We just want to make sure that the equity is there, and that the people who are here have the same and equal opportunity to enjoy the vaccine and to be safe. And the way to do that is to set up the additional sites that we recommended, and to set aside, again, we'd like to see 50% of the vaccine that is here go to Prince Georgians, or in the alternative, just set up specific days where Prince Georgians can go to that site and get the vaccine and have the rest of it go through the rest of the state.
What do you think of the convention center approach, where they're targeting, convention center in Baltimore is targeting specific zip codes?
Yes, and you know what, something like that, and again, it's just changing the approach. I think changing the approach, so using the zip code approach would be great, but again, if we can just get the vaccine for some of our sites, we can get these vaccines into people's arms. First Baptist Church of Glen Arden, the University of Maryland College Park, we're going to be doing the pop-ups at the churches and other places. We're working with Casa de Maryland. We can get these vaccines in people's arms if we just have the supply. We can get it done.
Your reaction to the news that a former police chief here in Prince George's County has been arrested as a serial arsonist?
Yeah.
A number of cases here in Prince George.
Yeah, so this is, obviously all of us understand the seriousness of it and are concerned about it. This official apparently was here 2 decades ago in our department, and went on to commit crimes across Maryland. And I really just want to congratulate our fire investigators, the investigators from the police department who worked in a collaborative method with other investigators from across the state over the last 10 years to charge this individual, and we look forward to bringing him to justice. You say know of her? I do know. Yeah. Well, I don't know reputation, but yeah, I worked in the state's attorney's office, obviously with Mary Crawford.
Surprised that a prosecutor and a police chief caught up in this thing?
I'm surprised anybody's caught up in it, so I don't know what else you want me to say about that. I mean, this is a shocking crime. The gentleman who's been charged, I mean, I think all of us are shocked. I mean, these are pretty shocking facts.
Next question.
So,
What was the March 15th site you mentioned?
the First Baptist Church of Glen Arden. Yes, that's the one with in collaboration with UMS. Yes.
Okay.
Thank
There's
you.
nothing further. Thank you.
You worked hard today. That's good. But you look good, Steve.
Thank you.